Good day to you all. Welcome to our echo session for today. Our sharing session is made possible given the funding support from the Gates Foundation. My name is Francis Ochen from the African Society for Laboratory Medicine. I'll be your moderator for the day. Our session will run for 1 hour. We will take one shared presentation and get into the questions and answers. We kindly ask you to join the discussions through the chat. Generally, that is your only way to join the discussion. We do have language interpretation services. Please keep to either English, French, or Portuguese, depending on the language of your choice. Session slides will be made available in a day or two, and then the recording too will be processed and made available to you through our multiple social media channels. Today we focus on Mozambique, their strategy to sustain lab services delivery in the face of global health financing limitations. We are aware that the current health funding cuts to the facets of health programs and lab initiatives has really impacted our diagnostic capabilities, our reach with diagnostic services, and it throws us into a great state of really uncertainty. And that is not the space you would want to be if you're running any program. But with this, we know that countries and health programs are also developing strategies not only to sustain earlier gains, but also to ensure that there is sustained delivery of most critical services in a more sustainable manner, with or without normalization in the funding environment. And so in today's session, we will share Mozambique's progress in developing and implementing some of the strategies in the context of reduced funding to build a very resilient lab services and networks. And to take us through this, we have two presenters, the main presenter and then the second person will be providing some commentaries and supporting with answering questions. So our main presenter for today is Deonilde Saramento, and Deonilde is the focal point for lab diagnostics with the National Program for the Control of STIs, HIV and AIDS in Mozambique. And the person that will be supporting Deonilde is Dr. Felix Pinto. And Dr. Felix Pinto is a clinical pathologist and is currently the head of Department for Diagnostic Support Services with the Ministry of Health of Mozambique. So let me hand it over to Deonilde to take us through the presentation, and then we'll get to the questions and answers thereafter. Thank you, and over to you, Deonilde.
So I'm going to commence the presentation. This presentation is called Building Resilient Laboratory Systems, Mitigation Strategies under the Reduced Support in Mozambique. This presentation has to do with cases, laboratory cases, and as announced, the problems and issues and challenges we had in various aspects. And we're going to talk about background, the laboratory network management, what are problems of financing, also the communication cascading policies, and especially, which is the more important in this presentation, what were the mitigation strategies that we have experienced, that we have developed, what were the lessons learned, and the transition period, and also what are the next steps, and also related with our needs for technical support. I'm going to start by saying that Mozambique has a network, a laboratory network, with an extensive territorial, we have 503 labs 15 of which molecular labs, with a coverage of 27% coverage. We also have laboratories, we have platforms, which is the pop molecular, 367 POC, 135 mpm, and 232 XPEN. These, we also have 41 conventional platforms, which in this form we have 3.4 million of molecular tests done. And our average utilization for all these platforms and equipment, it's between 68 and 72%. What are the areas and sites that are financed by the US government? We have financing all of the areas. We had to do reagents and consumables for TB and also others. We also have maintenance contracts, lab maintenance and service contracts for the maintenance of our equipment. We also have a very good, large support for the transport of specimens from peripheral health facilities, and also that includes fuel, courier contracts and fuel for vehicles and motorbikes. We also have finance with regard to human resources, which has a great part of our staff. They are funded and supported by these funds. And we also have support with regard to the technical training of laboratory technicians. We also have support with regard to the external quality assessments, and also for the we also have support with regard to mentorship, so partner support, supervision, mentoring, and also in the form of the auditings that are carried out. We also have supports in the technical mentoring by detaching teams for the supervision and to assess how the activities are being carried out. We also have supports in the development of guidelines and SOPs in order to ensure a quality service and a standard support. And we also have a great support with regard to laboratory information systems. And to this event, we have all the systems that is digital tools for result return for our laboratories. In regards to the monitoring of data and SMS platforms and dashboard, we would say we have about 80% of all the costs, laboratory costs, are funded by the funder. Mozambique responds to the funding pause and with all the support to the areas that I have mentioned, that has been support that has been done by the USDA. We have ensured an efficient communication, rapid at all levels. But at the provincial level, we had the shared updates on logistics and sample referral challenges, which was an area that was in which the support came very swiftly. We also had aligned priorities of the service continuity, especially those with regard to the collection of samples. These meetings with the partners for the implementation of all these activities, district and provincial levels for the regular coordination meetings to prioritize activities. We also had meetings with donors in which we discussed funding, these, the issues and the challenges that we had in order to work on a coordinated manner. We had also advocated for sustained support in critical areas, particularly for the critical areas, in order to set up mitigation measures to support in critical areas. We also had meetings for logistics in order to negotiate and to assess all the consumables and all the shipments to verify all those that have been sent during the logistics process from the procurement up to the various areas for mitigation. The areas that were mentioned before, in which have shown that we had external support, there was an impact, forced impact on human resources and training. We had contract termination for technicians who were funded by the partners, counselors, and some support staff. And to say we had approximately 20,000 professionals whose contracts were at risk. We had an immediate suspension of all training and mentorship activities at district and provincial levels, and also at central level. And also we had a drastic reduction of district and provincial QA supervision visits at district and provincial level. And also there has been an increased workload for remaining government health staff, particularly technical staff that have been supported and who were being supported by the US government. And there was also, in a way, loss of a specialized expertise previously funded by the US partners who were supporting us in terms of mentorship. How did we position ourselves? We had drawn up measures to create an internal mentorship model in which at work sites implemented in service training and a peer-to-peer mentorship model for the suspended programs, and these were done at the local levels. We also had training to focus certain laboratories and to, for instance, we had target capacity building, training focused on new mitigation strategies and activities, particularly with regard to the load variance. We also have done this as far as the testing on the TC4, where testing was done, where they have been migrated, taking into account the quality that was necessary to ensure such transition. Also, in the areas of the protocol quality approach, we had taken into account all the aspects that had to be taken into account. We established a strict rule for sites without required training for sample collection and to ensure that everything would be carried out within the necessary standards. We, for instance, in sites where there was no training for the POC, where this was not existing. With regard to the consumables, we also had in the commodities impact, and we had certain delays in certain key activities. We had delays and shortages in the procurement of key diagnostic supplies. We also had an increase of the viral loads. They forced the prioritization of viral load testing for suspected treatment failure, and also with regard to molecular testing, with regard to mitigation, we also drawn out the various standards for the viral loads, and also we adopted a transition of the testing, the DBF, in certain sites using existing reagents and also by taking a contingency plan, particularly with regard to the TB, in order to ensure the necessary proctoscopy. There was also the reallocation of certain items that had been anticipated with regard to certain reagents and also as to their repositioning in various laboratories across the country. With regard to laboratory information systems and connectivity, we also had an impact because with regard to suspension of internet, and also we had to immediate return to the paper-based data record. We also had an absence of information, a loss of real-time data reporting and visibility at central level and provincial level, and also in some respects for the peripheral areas. We also had delayed result transmission, and in this way it compromised the clinical decision making. We also had the withdrawal of certain computers and printers, and as you can imagine, this had affected drastically in the follow-up processes and also with regard to the laboratorial areas. As mitigation actions, we had a manual registration. We resorted to manual registration. The system immediately reverted to manual paper-based registration, and we had to intensify this area. And as you can imagine, it had some impact into the whole of a cascading effect. We also had a strategy which it was recommended that there's a reallocation of all the instruments, both in the paper and computer systems, and also to review all the contracts that were existing with regard to the allocation of computers in the health areas or units. With regards to the sample referral and logistics, there was an interruption of the last mile transport network. There was also an increase, or a spike increase in the TAT from days to weeks and to months. There was also a higher rate of rejected samples due to compromised integrity, due to the difficulty that we had with regard to the financing of regard to samples. And also there was a reduced movement of VL, EID, CD4, and TB samples, which the country's been doing in an integrated form. So this cut has had an impact in a very negative way. As mitigation measures, apart from the
que foram
meetings,
feitos, houve redefinição dos
we
fluxos de
had a
transporte da
redefinition
amostra,
of the
redução de
transport of
frequência do transporte da amostra
samples.
e
We had to
também
consider them
repriorização de
integrated
alguns
transport
locais
flow, the
para
system
o
issue
transporte da amostra
coordination
e também criação
whenever
de
possible.
novos pontos
And
de
also
convergência,
we
de
had to
forma a
create a
garantir
new
que todos os
convergence point
locais
in order
pudessem
to ensure
fazer
that
o
all
transporte
the
de amostras pelo
could
menos
be
2 vezes por
uh,
semana.
that
Para os
samples could
laboratórios
be
de referência
transported at
também
least
foi
twice a week.
redefinida o
With
agendamento
regard
para o transporte
to
da amostra,
the
em que
route
definiu-se
adjustments, new
pontos de
collection dates were
convergência
agreed upon and
novos para que
adjustments
se
were
pudessem
made. And
fazer
we
o
also
transporte da
the
amostra
conditional
de forma
collection, the HF that could
eficiente e
perform
pudéssemos
referencing at
cobrir
least twice per week
70% de
so
todas as
that we
amostras
could
que eram
at
colhidas e
least
da
obtain
necessidade de
40%
transporte da amostra,
success
mesmo
in,
com a
with
paragem.
regard to the transport of the samples.
Também foi feita a transição
We
do
also
tipo de
had carried out
amostra
transition
para
to
casos
stable
específicos. Analisamos
samples
caso a caso,
where
província a
SRS were
província,
not possible.
laboratório,
They were
dependendo
examined
da
province by
situação de cada
province,
um. Foi
and
feita a transição de
we
DBS para
did
o
the
plasma,
transition.
para plasma separador
The
plasma
system
separation
mandated
card,
the use of
desculpa.
DBS, the dry blood spot,
Também para
or
amostras de
PSC,
CD4 para algumas
and
unidades de
also with
gramos
regard
da
to the
testagem
CD4
convencional, neste
testing for
caso, para a
peripheric
testagem
HF
usando
without
o
laboratory,
VisiTech, que é um teste
sample
rápido
collection was
para a
recommended according to the
tuberculose.
availability of transport.
Também foi
In regard
feita
to tuberculosis, we also
a redefinição
we
da
had to do a
periodicidade para o envio de
redefinition.
amostras de
Samples
cultura
for
para os
culture
laboratórios de
and ESD
Nampula,
were
Beira,
referred
Maputo
at
e
least twice per
Carmelo, que
week to the
são os
respective reference
laboratórios de
laboratories,
referência para o
Nampula,
culto.
Beira, Maputo, and
Quais foram as lições
Carmel.
aprendidas?
What were the lessons
O
learned?
país tem que ter um plano de
Country
ação
has to have
proativo para
a
melhorar a
planning.
coordenação e a
It must
comunicação. Foi o que aprendemos
improve the
durante
coordination. In other words,
esta
we had a
paragem
proactive
e
planning and
também já
coordination
desenharam
that are considered
uma medida
critical.
de
To this
mitigação
effect, we
ou de
already have drawn
contingência
up
antes que esse tipo de
contingency and
situação
mitigation
aconteça
measures.
para que se possa
These
acionar em
have
caso de alguma
help reduce
dificuldade
the
ou
external
limitação para a
dependency and
continuidade
strengthen
de serviços.
sustainability for the
Também deve
continuity of the
reduzir,
service.
desenhar
We
medidas
should
para a redução da
also
dependência
have to
externa e
reduce
também
the
justificar
external
medidas que garantam a
dependency and also to
sustentabilidade dos
have
serviços
measures that ensure
laboratoriais.
the
Manter
sustainability.
uma
We should
parceria e
also
transparência na
maintain
comunicação desde o nível central,
partnerships and
provincial,
transparent
doadores,
communication
como é que
across
são
central,
realizados os
provincial
contratos, toda a área
donors and
logística
suppliers,
e
build
garantir
trust
que todo
and
este sistema aconteça de
long-term
forma
resilience
resiliente ao longo prazo.
throughout
Também
at
devemos
long term.
advocar
We also
para a
want to
capacidade
take
doméstica,
advocacy
tanto
here
em
for
termos de
to
recursos
increase
humanos,
the internal and
como
domestic
também
capacity, in particular
em
with
termos
human
da
resources,
cadeia
and
logística, de
also
forma a garantir
with regard to
sustentabilidade
the
de
logistic,
todo
the
este
channels of
processo e
logistic,
também
and
passando e
also
capacitando
to
a
increase the support and capacity
e passando a capacidade para a área doméstica, para o país,
to
neste caso.
domestic
Também, como
resources and
forma de
capacities.
mitigação, de uma
Also, as a
forma
form of
macro,
mitigation,
desenhou-se
we
plano de transição, em que
we
neste
drew
plano
up
de
a
transição
transition
fazia-se a
plan
transferência de
which had
alguns
to do
aspectos, de
with the
algumas
gradual
atividades,
shift
de
from
algumas
donor-driven
responsabilidades
to
do doador
government-led
para o
operational
governo, mas de
support,
forma sustentável e
but
operacional.
in a sustainable way,
Fortificou-se e
also to
fortaleceu-se a
strengthening
nível das
of
províncias toda a
provincial and
capacidade
district level
logística.
logistical capacity,
Também fez-se a
and also the
institucionalização das medidas ou
institutionalization
das
of
estratégias que
successful
funcionaram
mitigation
neste tempo de
strategies,
paragem e que
which
pretendemos
worked during
manter
this
para
time
garantir a
of
sustentabilidade de
that
nossos
we were
serviços
paralyzed.
e
Also, the
também como
diversification of
medida de
supplies and
transição e mitigação,
optimization of
fazer a
procurement,
diversificação da área logística de forma a
particularly
otimizar
with
os processos de
regards
aquisição
to
que o país tem
towards
levado a cabo.
optimizing the procurement systems.
Devemos desenvolver
We also
e
should
fazer a
develop
passagem do sistema de
hybrids,
informação
LIS
laboratorial
solutions
para o Ministério da
by
Saúde
it's
e
changing
garantir
this,
também
shifting
que
the
as
system
medidas que
into
foram
the
levadas a
ministry
cabo
and
e que
also the
funcionaram
taking into account the measures that worked
elas devem
to
continuar
sustain effective
para
mitigation
garantir a
measures
sustentabilidade e manter também
regardless of
práticas de
future donor
resiliência que
support,
podemos mostrar
and also to
no período
embedding
desta
resilient
paragem e
practices
manter
into
também
routine workflows to
produtos já
ensure
existentes e que
long-term
mostraram sustentabilidade
sustainability.
e resiliência.
sustainability.
Quais são os próximos passos
What are the next
técnicos e
steps
necessidade de
and
assistência?
technical
Devemos
assistance
continuar a
needs? We
advocar
should
para o
maintain
aumento
advocacy for
do
increased
financiamento
domestic
doméstico
investment in
para
laboratory
a área
systems.
laboratorial. Devemos
We should
continuar
also do
a fortificar,
capacity
fortalecer a
building and
capacidade
ownership
a nível das unidades
for
sanitárias, nível
provincial
distrital,
and
nível
district
periférico do
level
nosso pessoal.
units and staff.
Devemos também dar
Also, we should
suporte
also provide technical
na
support
área digital
for
e
digital
integrar
health
os sistemas
integration
já
and
existentes
monitoring
e
tools that
devemos
are already
continuar
existing.
com a
And we should
colaboração
do
e a
continued
busca ou
collaboration with global
encontro de soluções
partners
junto com os parceiros que garantam a
for
sustentabilidade dos
sustainability
sistemas laboratoriais.
in laboratory systems.
E muito obrigada.
Thank you very much for your attention. And that's all.
Thank you, Deonilde. Excellent presentation there from you on behalf of the Mozambique Ministry of Health and the Department of Lab Services. What an experience from there. You've demonstrated that the familiar narrative for most of the countries is holding for Mozambique as well, that a significant amount of your lab services was really depending on donor funding, 80% or thereabout. And also you've shown us that the impact of the withholding of funding has been wide-ranging. It's not only affecting one area, human resource, your actual testing services, your sample referral network. Every aspect of your lab network is affected, given that. But you've also demonstrated that engaging stakeholders when it comes to coming up with what our next steps should be to ensure that we sustain the lab services, what our next steps should be, should actually bring in everyone to the table, the partners, the Ministry of Health officials, the implementing laboratories. So everyone, so when you bring everyone on board, then it's very easy to implement whatever decisions you make from those strategies that you work with. You've also demonstrated that mitigation does not necessarily, if you get alternative approaches, it may not necessarily reduce the quality of the services that you're providing. Dropping from electronic to paper-based systems, getting back to more viable and long-term sample types, the DBSs from the very fragile and perishable sample type, the plasma samples, because your sample referral system could not run on a daily basis like it was before. So dropping to alternative sample types and therefore preserving the quality of the samples meant that you would still provide almost the same quality of services to your clients. And then finally, you also demonstrated that you cannot trade anything for your sovereignty because the responsibility is ours. And so donor funding should really come in as an addition, as a complement. And so now we need to be able to actually take on our responsibility, and then whatever comes in from external sources can just add on to that. So colleagues, let the questions keep coming in the Q&A space. We will be dealing with all those, and we are glad that we have some good amount of time. But before we go to the questions, let me hand it over to Dr. Pinto to just give us some quick comments following this presentation, and then we'll get to the question and answers. Dr. Pinto, over to you.
Ok, obrigado, Francis, pela
Thank you,
palavra
Dr. Francis,
e
for giving me the
obrigado
floor.
a
I
todos que
also would like to
atenderam
thank
a
to
este webinar.
everybody
Quero
who are
saudar todos os
present in
colegas
this.
que
I would like to give my
fazem parte
greetings to all the
desta
colleagues
plataforma, né, de
that
diálogo.
form part of this
E, em primeiro
platform.
lugar, isto tudo
Firstly,
que a colega Dionildo muito bem
everything that
apresentou
my
até
colleague
ao detalhe,
has presented
parece
very
muito
well,
simples quando
it
olhamos
might seem very
para os
simple
slides, mas
when one
foram
looks at the
vários
slides,
momentos de
but
tensão,
these
vários
were
momentos também de incerteza.
various
E, em primeiro lugar,
moments
para
of
alcançar o
uncertainty in
mínimo
order
do que
for
foi
us to
demonstrado
ensure the
aqui,
minimum, as
foi
we had
importante
demonstrated
uma
here. It was
comunicação
important
imediata,
to have an
rápida,
immediate
entre
communication, fast, rapid
nós,
communication.
como serviços de laboratórios
We, as
diferentes,
laboratory
clientes do
services,
laboratório, que
to
são
have to give to
principalmente
our
a Direção
clients
Nacional
who
de
are
Saúde
mainly
Pública
that
e
are the
os
public
hospitais.
health directories
Este
and all the
foi
public
dos primeiros
hospitals.
aspectos
This was one
mais
of the very
importantes.
first
O
and most
segundo
important
foi
features that we had. The
conhecer
second one
muito
was
bem a
in order
rede
to know very
de
well about the
laboratórios, não é?
network of
Os exercícios de
laboratories
DNA e
for the
DNO que foram
DNA
feitos em
services that were
Moçambique
carried out
recentemente,
in
o
Mozambique
mapeamento
quite
de laboratórios
recently,
através da ferramenta
the
LabMap, né?
expansion of the
E também
laboratories
o
through the
conhecimento das
tools of
necessidades
PAGMAP,
tanto do programa
and
do
also
HIV, programa
making
da
know about
tuberculose
our
e também as
needs regarding
necessidades
to
dos laboratórios
HIV and
foram
the TB,
determinantes para
and the
poder
needs of the
fazer e
laboratories that
tomar
were
estas
determined in order
decisões, né?
to for us to
E
take
o
decision
terceiro
or for the
aspecto
decision.
foi
And
a
thirdly,
comunicação
was
com
the
os níveis
communication
superiores, né?
with
Tanto do
superior
Ministério da
levels, the
Saúde,
higher levels,
como
such as
também
the Ministry
dos
of Health,
parceiros, a
as
expressar
well
uma
as the
necessidade
partners, in order
e
to
aqueles
express
parceiros
needs,
que
and
agora
those
tinham
partners
financiamento,
that
ver como é que
were
poderiam
still having
suprir
some
as
the
lacunas
finance,
que
how they could
apresentávamos
cover
no
for
momento, né?
our
Porque nós tivemos
needs,
dois
because we
períodos de
did
paragem,
have
uma
two periods
em
of
janeiro
stoppages.
e a
One was
segunda
in January, and the
no
second
meio do
period
ano, e a
was at the
experiência da primeira
mid-year,
paragem
and the
foi
experience of
determinante
the
para a
first
segunda,
stoppage
né?
was
E
important
isto
for
deu
the
maior
we had to
capacidade
deal with the
de
second one, and
perceber
this has
qual
provided us
era
the
o nível
capacity. So,
de
what
preparo ou
was
de preparação que as
the
equipas tinham
necessary
para
preparation
absorver as
in order to
adversidades.
absorb
E
our
no
needs?
final
And
deixou-nos
at the end,
algumas
it
tarefas para
left
além das
us with
lições
some
aprendidas.
tasks, in
Ficamos com
addition
algumas
to those that
tarefas,
we
onde
had
o
been left
primeiro
with some tasks, where in
a
the first
gestão de
place,
recursos
we had
humanos
the
deveria
management of human
estar de uma
resources
forma
was to
montada
be
para não
in a
termos
very important
desafios
way,
na
so
prestação de
as
serviços, não é?
so that we
Como
should not
viram,
be left to
teve um
challenges. As
impacto de
you can
mais
see, we had an impact
aproximadamente 20
of
mil profissionais, mas a
it
maior
had an
parte destes
impact of
profissionais
more
estão
than
ligados
20,000
a
professionals,
aspectos de
most
cuidados
of
e
which are
tratamento.
related with
Felizmente, na área de
primary
laboratório, nós
care
temos
and
muito
others.
poucos
Fortunately,
profissionais que são contratados
we
por parceiros que fazem a testagem ou a prestação
had
de
only very
serviços diretamente.
few
Mas temos
that were
aqueles quadros
contracted,
que criam a
but we
demanda
still
de
have
serviços
the
para a área
technicians that
laboratorial e
provide
teve um
services
impacto
for the laboratories,
extremamente importante.
which
Então,
had a very important
Moçambique já tem
impact. So
uma
Mozambique has
estratégia
now already a strategy
desse subsistema comunitário
of
para
a
poder
community
abordar a
subsystem in order
falta
to
de
approach
parceiros ou de profissionais
the
ali na
lack
comunidade
of
para a
any
criação
funding
de
or
demanda e esperamos que com
partners
esta intervenção
support, and we hope
possa
with this
mitigar
intervention
os
we
aspectos
can
que nós observamos em
be able to
relação
mitigate
à
for those
demanda do
losses
serviço do HIV.
in regard
E
to the
segundo é
demand for
que
laboratory
dentro da
services. And
estrutura do
secondly,
laboratório
within the structure
começamos
of
a
the
fazer
laboratories, we
advocacia
started to
para que
start our
efetivamente
advocacy to
o
in
ministro possa
so that the
passar a
minister
mensagem de que
can
os
pass the
serviços
message
de
that
HIV, de diagnóstico e
the
tratamento
HIV
têm de
services or in
ter uma
diagnostic
percentagem
service
maior
must
do
have a
orçamento do
greater
Estado na sua
percentage,
participação
must draw a
doméstica,
greater
né?
percentage out
Então,
of our
tanto
state
a
budget,
saúde pública
and
para cuidados de
particularly bearing
tratamento,
in
como
mind
nós,
the
no
importance for
diagnóstico, já
public health,
sinalizamos essa necessidade
since
e esperamos que
diagnostics is
com
very
os planos de
important. So we
transição
hope
isso
that this
aconteça.
could
E o
happen in the
ponto a
future.
seguir é em relação
And
à
also
logística,
what I want to say is about the
atualmente está a
logistics,
ser
which
trabalhada
currently
e
has been
uma das
worked
propostas
out.
é
And
que
one of the
os
proposals
processos de
is
contratação
that
que nós vemos a acontecer com os
contracting
parceiros, a
procedures,
expertise ou a experiência que é
we
detida
must take into
no
account
lado
that
dos
the
parceiros começa a ser
expertise
transferida
that
para o
there
nível
should be a
governamental
transfer of
e
skills
não
from
tenhamos as dificuldades que temos atualmente.
those that have
E,
been
por
contracted.
fim, é em
And
relação a sistemas
finally,
de informação,
also with regard to the
onde há uma
information
necessidade
systems,
de, a
where
nível
there is a
continental,
need
sabemos que
at
tanto
continental
a
level.
CDC,
You
a
know that
SLM já tem
CDC Africa
ferramentas como
has
o
already
mapeamento de
tools such
laboratórios, agora
as
está a ser
photos
trabalhado
for
em
the
relação
laboratory,
a
which has now
referenciamento
been
de amostra
has
e
been
também
worked up,
de
worked
sistemas
up,
de informação
and
laboratorial
also
que
the
possamos
laboratory information
ter a
systems in
possibilidade
which we could have the
de
possibility
pilotar
and the
esses mesmos
capacity
sistemas e
to
fazerem parte
use
das
these
estruturas de
systems
gestão dos
as part
países
of
e
the management
dependerem menos de
structures, and
financiamento externo para
also
sustentabilidade
for
e
us
também
to
depender menos do
depend
financiamento doméstico
less on the
para fazer
external
investimento. Portanto, estes
assistance.
são os aspectos
So
que
these
vale a
are the
pena
features that
abordar e
uh,
investir em
that
redes de
is worth
laboratórios
mentioning
para
with regard
evitar
to the laboratories
que haja
in order to avoid
situações que colocam em risco a
situations
prestação do
that
serviço.
could put
Estes são
in
os pontos que eu queria
our
abordar de forma
service rendering
sumária,
at risk.
Francis. Não
This
sei
is
se
what I
podemos
would like to
passar
say.
para
I don't know if we
as questões
perhaps could
do
now
chat.
go to
Obrigado.
the questions period. Thank you very much.
Thank you. Thank you very much, Pinto. Pinto, the clinical pathologist who is currently the head of the lab department at the Ministry of Health in Mozambique. Very insightful comments there following the presentation from Deonilde. So let's now get to the questions, and we have at least some 20 minutes or about that to deal with some of these questions. And Pinto, let me keep it with you and just there is this question that is speaking to the initiative that is happening and we're sharing from the lab department. Is this a health sector-wide initiative, meaning all the other departments within the Ministry of Health are also working towards revising their practices to align with these services, to align with the challenges with funding? Or it is currently only the lab-led initiative, and maybe the others will follow us later. So just to ascertain whether this is happening only from the lab side or it is across board, and if it is across board, at what point are we coming together so that one initiative from one corner is not compromising performance and contradicting what the other corner is coming up with? Dr. Pinto.
Great
A
question.
estas
With
iniciativas,
regard to these
elas
initiatives,
estão a acontecer
they
de uma
are
forma
happening in a way
compreensiva, isto
that
é,
is a
todas as
comprehensive way.
direções
That is,
foram
all the
obrigadas a
heads and
rever os
directors
seus planos,
were
a
forced to review
rever
their
as suas
plans,
estratégias
to
e,
review their
na altura,
strategies.
também o Ministro
And
da
at that
Saúde
time,
desafiou
the
a
Minister
todos os
of Health
diretores
also challenged
nacionais, ao
all
nível do
the
Ministério da
national
Saúde,
directorates
para
in
fazerem
terms of the
uma
health
revisão
department in
daquilo que é
order
a
to
visão e
review
estratégia
of
das
the
suas
strategic
direções e do
vision of
Ministério da
their
Saúde
own
para os
departments
próximos anos.
together with the Ministry of Health for
O
the
segundo
next few
aspecto
years. The
desta
second
intervenção
aspect of this
conjunta
intervention,
é que
this
nós começamos a
joint
interagir
intervention, as we started to
com os
interact
diferentes
with the
departamentos e direções,
different
por
departments,
exemplo,
for
na área
example, in
de
the area
diagnóstico
of
laboratorial,
diagnostics,
interagimos
we
muito com o
interacted
programa do
with
HIV, o
the
programa da
HIV
tuberculose, da
program,
malária, o
TB and
programa das
malaria,
doenças não transmissíveis,
also
né?
the
Para ver até que nível
non-communicable diseases,
estes
to
desafios
determine
também
at
nos
what
levam à
level that of
integração de
these
serviços laboratoriais,
challenges
bem
and
como
with
nos
regard to
levam
integration
a
of the laboratory
pensar de
service
forma
to
conjunta
make us think in a joint, with a joint vision with regard to the strategies towards having a regional laboratory that could do the testing for all of the pathogens.
maior.
Uh,
Então, este tipo
so
de
this type
abordagem está a
of
ser pensada
approach is
e
being
com
thought,
ele nós incluímos
and
na redação
we
da
have
nossa atual
also
estratégia de laboratórios
also
algumas
have drawn up our
medidas que
strategies
nós
for
queremos
the
ver
laboratories, and we
melhoradas
take into
para
account
a
certain
área do
measures
laboratório
in order
nos
to,
próximos anos.
in
Tendo
the
em
next few
conta e
years,
tendo em
taking
mente
into
que
account
questões
that
financeiras
there are
vão
financial
impactar as nossas
issues that
intervenções.
will have an
O ministro
impact on our
também
action.
desafiou-nos a ter
The minister has also
ideias
asked
inovadoras
us
que permitam-nos
to
usar
have
melhor os
new and
recursos
innovative
laboratoriais. Então,
ideas
estes
with
são os
regard to
principais desafios
laboratory
que
resources.
se tem
So these are
estado
the main
a,
challenges
abordar. E,
that
por
we have
fim,
been tackling.
a questão que
And
nos,
lastly,
entre
the
aspas, tira o sono, que é do
question in
referenciamento
inverted commas
laboratorial.
that
Só para
taking
terem
us,
uma ideia,
keeping us awake,
para a
it's
nossa
just
área
to have an idea.
territorial,
For our territorial
Moçambique,
area,
que se não estou em
Mozambique,
erro, deve ter
if I'm
800
not
quilômetros
mistaken, we
quadrados
have
ou mais.
800,000
Nós
square
temos mais ou
kilometers.
menos
We
2
have
mil
more or
unidades
less
sanitárias e que, cuidado para
2,000
fazer o referenciamento
health
das nossas
units.
amostras,
And in
custa-nos
order
ou
to
está a
process these
custar-nos mais ou
samples,
menos
it's costing
5,2
us
milhões de dólares. Então,
$5.2
nós temos
million.
de arranjar uma
So we have
estratégia de
to find some
transição
way
que nos
to draw
possa
up a
baixar este
strategy
custo e
that
que se torne sustentável
would
para
help
a
us to
economia
reduce this
doméstica. Estes
cost,
são, por
which is
exemplo,
turning
uns
out to
aspectos
be
que estamos a trabalhar
unsustainable.
também.
So these are some of the aspects that we've been working with. Thank you.
Great there from the Mozambique team. Let me give it to Daniel, and this is a question that is coming in from a colleague who wants to know how you're trying to limit your cost based on in-house production of what you need to use. And I am extending in-house to mean also probably in-country. So are we beginning to see, and maybe this is quite early, but are we beginning to see some traction in the areas of some things being produced locally, and therefore the cost of acquiring them might be cheaper, so that then you transition to local acquisition of locally manufactured items? This also extends to some of the contracts that we have seen with our equipment maintenance and calibration. And so the question is extending to, are we doing in-country, country-level calibrations, or are we still outsourcing some of the equipment maintenance and calibration contracts from outside that seemingly are more expensive than if you are doing it locally? Deonilde, if you have some experience in that direction to share.
Obrigada pela pergunta.
Thank you for your
De uma
question.
forma geral,
In the
é algo
general
que
way,
também nos preocupa
there is
como
something
país
that
e
we are
especificamente para a área laboratorial
worrying us,
e já
particularly in the
temos
laboratory areas,
iniciamos
and
discussões
we had already
relacionadas a
some
esse aspecto,
discussions
contudo ainda não
regarding to
temos,
this matter.
para o que diz
However,
respeito
we
exatamente a
we
reagentes
we do
ou
not
e
have
alguns
yet in
consumíveis
the area of reagents, local
locais
reagents,
nacionais para a produção dos
in
mesmos,
order
mas
to
já tivemos
produce them
alguns
locally.
encontros
Although we
com
have
algumas
already had
iniciativas a
some
nível
meetings with
tática,
some
como por exemplo, se não
initiatives,
me falha a memória, a
such
marca
as, if I'm not
facets ou algo assim,
mistaken, my
que vai fazer a
access
produção de alguns
in
testes
order to produce some of
localmente.
the
Então já
tests
iniciamos
locally.
e
So
temos
we already
verificado o que eles
started.
vêm fazendo ou elaborando
We have been
em outros
visiting and
países e que
looking
podemos
at what they are
transferir
doing
aqui
and
para nível
considering
nacional.
what we can
Temos
do
também
to transfer them
iniciativas
national. We
através
also have
do Educação,
initiatives
Saúde ou de outras
at the
entidades
National
para
Health
a
Institute
elaboração de
for
painéis
the
de proficiência
creation of
de nível
proficiency
nacional, nível local,
panels at
para a
both
distribuição
local
dos
and national
laboratórios, para a
for
garantia de
the
qualidade dos mesmos.
laboratories in order
Temos também
of
uma iniciativa que está a
quality
ser levada a cabo a
guarantee,
nível
and also
nacional, que é
what we're doing at national
o
level
início de um laboratório
to
para calibração
commence a calibration laboratory
instrumentos como pipeta
on
e
some of the
equipamento a
instruments
nível
and
nacional
also
e
for
temos agora
equipment and at
iniciado
national
algumas
level.
conversas
And we have already
para
started some
procurarmos
conversations
financiamento para a
with regard to the
capacidade
financing
nacional
for national
de técnicos
capacity
certificados
for the
para o efeito de
technicians
calibração e alguns outros
for the
custos.
purposes of
Não sei se
calibration of
prefere que
equipment.
saia um
acrescentar,
I
acho que
also
havia
would
aqui
like to
também
add,
a Fatinho já
we
lá na sessão. Moçambique submeteu
Mozambique
para a área
has
de manutenção
that
de
in
equipamentos
the area of
laboratoriais
maintenance
uma
of laboratory
proposta
equipment
a
is a
um dos
proposal
doadores para que nós
for
pudéssemos desenvolver
that we can
no
develop
país a semelhança
in
do
the
que nós
country
vimos acontecer
as
na
we have
experiência
seen
partilhada,
in the
acho que foi
experience
da
shared
Zâmbia ou do
with the
Zimbábue,
Zambia or
e
Zimbabwe
através do
and
Uganda, né, que já tem uma
also
experiência muito
through
grande
Uganda,
na
who have
manutenção
already
de
a very
equipamentos laboratoriais e
large
hospitalares,
experience in
para que nós
maintenance of
pudéssemos também
equipment,
desenvolver
so that we
uma
can
iniciativa
also
igual,
develop
onde
a
nós
similar
pretendemos que
initiative
até
where we
próximo ano
wish to,
consigamos
perhaps next
formar
year, we
profissionais
can train
da área de engenharia
professionals
biomédica e
on
também
biometric
capacitar em termos de
engineering
infraestrutura
in
e
order
de
to create
equipamentos para que
infrastructure and
possam
equipment
prestar
so that
assistência
they
aos,
can
aos equipamentos
uh,
laboratoriais para
tender
garantir a qualidade
technical
e
assistance in order
confiabilidade que a
to
Dionilde
guarantee the quality of
falou. Então,
it.
estes são
So
aspectos que já
these are some
colocamos,
aspects
que
that we have
esperamos que
already
dê
considered, and we
fruto.
hope that we will take them further.
Thank you very much. And that last bit is really very important for us. Countries learning from one another so that we do not reinvent the wheel. You can actually just avoid some of the mistakes that were made in that earlier attempt and move it faster. We've seen a few countries learning from the experience in Uganda, and they perfect it and actually move faster to getting the equipment calibration centers established and moved towards accreditation. I have a quick one from this side, and then I'll go to Dr. Pinto. There is a question from Antonio in Portuguese. Kindly pay attention to that and you will answer it after this one. But for now, let me first put this question to you. Let Nilde maybe deal with this as you're looking up that question from Antonio in the Q&A space. Now, Deonilde, I know that when we got to know that funding was reducing, then we started restructuring our sample referral network so that the people who are picking samples are not going out every day to try and manage the cost. And that therefore led to the decision that you then should have your samples collected as dry blood spot samples because they're more stable. My question is, you already have some supplies that you cannot also just let go to waste. That was meant to support you with the plasma sample collection. Are we still creatively, and even reagents that relate to that, so are we still creatively using them? Or for now, we have put those other supplies aside and we're using only the DBS supplies so that we can get the stable samples. Because if we know that the rider is coming 2 days away, samples that I'm collecting today, I can use the DBS sample collection kit. The ones of tomorrow, I can use the DBS sample collection kit. But the day I'm expecting the rider to come, I can actually use my plasma sample collection kits because I know that day those samples will move to the lab and they will reach the lab the same day. So are some considerations being made in this direction so that we are not wasting some of the resources that are already in our system as we come up with some of these mitigation strategies?
With regard to
disponibilidade
the
e
availability
utilização
and
de material
use
de colheita,
of
o
the
que a rede
collecting
fez foi
materials,
analisar, os colegas
what
analisaram
the
toda a rede
colleagues
de
had done,
laboratórios,
they analyzed the
viram o que é
entire
que estava
network,
disponível
see
em
what was
termos de
available
kits de colheita de
in
amostra, quer
regards
seja
to the
DBS,
kits QDS, that is the one that was separating the plasma and the tubes, and to see at what we could use the different approaches that my colleague has explained. In certain sites, there was that we could collect the DBS and send the samples, but there were some other areas where there was the DBS because of the distance and for the stability of the samples, because in certain sites there were some difficulties in the laboratory testing. When the samples reached the laboratories, they had to still wait for a while, which created some situations where we could have total use of a DBS, but in certain cases we could use a mixture of DBS and the tube of plasma. With regard to the question of the Angolan colleague, I could say, but I'm going to give the floor now to my
Só para
colleague there.
acrescentar o que o
Would just
Dr.
like to
muito
add,
bem falou,
as you quite rightly
gostaria
said,
de lembrar que nós
we would
tínhamos
like
também
to remember
situação de
that
locais
we
que
had
o
a
carro não
situation where
passava
the sites where the
completamente e
motorist of the
tivemos
car would
que
not
recorrer a
pass by,
transporte
so we had to
da
resort
própria
to
unidade sanitária, por
using the
exemplo,
transport of the
ambulância
health unit,
ou
such as
alguma
an
moto que se
ambulance
fizesse presente
or
na
a
unidade sanitária.
motorcycle.
Então, para esses locais, porque a nossa
And
área
because
territorial no país é
in terms
muito
of our
extensa
territory,
e
we have a very
dispersa,
extensive country
para
and
estes
it's
locais nós
dispersed.
verificamos e
And there
mandamos
were some
medidas de
sites
mitigação
where we
específicas
had
para
to
cada local.
adopt
Tratamos cada
mitigation
local, cada
measures.
unidade
We treated
sanitária e cada
each
periferia de
health
forma
unit
singular e
in the
enviamos medidas
unique
de
way,
mitigação
and
específicas
we adopted
para as mesmas.
mitigation
E neste processo
measures
também verificamos toda a
accordingly.
nossa cadeia de
And here
abastecimento
we
para não
identified
corrermos
our
o risco de
entire
perder
supply
os
chain in order
consumíveis que
not to
tínhamos em
lose
detrimento de outros.
the ones that
Então,
could
criamos um equilíbrio também
or
sobre
use
que
it in a
tipo
way that
de
could be
kit de
done
colheita
in detriment of
usaríamos
others.
e
So
que
we had to
tipo
use
de
some ways
amostras
of
e
collecting
balançamos desta
and
forma
the
para
type
garantir a
of samples, and we
sustentabilidade
try
e
to
tínhamos comunicações quase que diárias
establish
para
or
garantir a
balance
efetivação
according to the
destas
needs.
medidas. Obrigada.
Thank you.
Só para responder ao colega
Just to
António,
reply
que
to Antonio,
fez a pergunta
who
referente
has made
à
the
implementação, se tem um implementador externo ou
question.
apenas o Ministério da Saúde com os parceiros, e
We
como é que
just
nós
said that
fazemos
this was done
o
by the
rastreio
Minister
de
of Health
amostras
in
e o
conjunction with
transporte das
and how we
mesmas.
do transport the
Nós,
samples.
em Moçambique, estamos a
We
usar
in
um modelo
Mozambique
que é
are
chamado
using a model
4PL.
which
O
is known
modelo
as the
4PL
4PL. This
é
model
feita a
4PL
gestão da
as the
frota por
one
um
who
parceiro
manages the
logístico.
fleet
Então, é
by a
contratar um
partner.
parceiro
So
logístico
we
e ele
contracted a
faz
partner, and
toda a
he is the
gestão da
one who
nossa frota
does
e
the
dos locais
management
de
of our
retirada de
fleet.
amostras.
Hello? Hello?
É feito
You
o
can't hear?
pagamento de acordo
Now it's back to
com a
the
necessidade. Então,
payment is
nós
done
usamos vários
in
meios
accordance to the
de
needs. So we
transporte,
use
desde
various means of
carros nas
transport,
rotas principais,
vehicles,
usamos
motor
motorizadas nas
cars in the
rotas
main
dentro dos
routes. We use
distritos
motorcycles
comunes e
in
localidades,
others,
e em
particularly for
algumas
the local
localidades há
communities,
necessidade
and
de
certain
utilizar there
there was
barcos,
in
né,
certain
para fazer
places there was
esse
a need
transporte
to
de amostra.
make
Então, a
you other
abordagem ela é
means
muito
for transport. So the
variada e
approach
tratá-lo em
is
Moçambique,
varied. And
atualmente
in the
é
case
esta
of
abordagem de
Mozambique,
4PL
currently we have this
que está a ser
so-called
feita. Nós queremos pilotar uma
4PL
outra ferramenta
method.
de
We are going to
transporte de
try
amostras
to pilot
diferente da
another
gestão centralizada
uh,
por 4PL.
initiative in addition to
E
the
todos os custos são
4PL.
pagos
And
pelo
all the
parceiro que é o governo
costs are
americano.
paid by the partner who's an American. I think he says American, I beg your pardon.
Thank you, Felix and Leonilde there. Now we were coming towards the end of this, but we have a question from a colleague from DRC. and is speaking to his or her question is speaking to business continuity plan going forward. And I want to add to that by commenting that we know that the stop work order may have come in January 2025, but the full impact we anticipate will be felt 1 year to 1 year and a half from when the stop work order was put in place, because we still have some things that were in the supply chain coming through. We still have some people who we stopped them from work, but they're still volunteering because they haven't got much to do. And so the full impact will be felt probably 1 year or 2 years from when this funding cut came to be. And so what is, in your opinion, is going to carry you through besides these immediate actions that we have taken, so that thereafter we can imagine that the general lab services provision will not be very negatively impacted going forward? And I will give this to Pinto, and you will say that with also your closing remarks. Then I get to Deonilde.
Obrigado, Francis, pela questão.
Thank you,
Essa é uma questão
Francis.
extremamente
This is a
importante
very
quando
important
olhamos
question
para
when we look
a
at
estrutura
the
da prestação de
structures
serviços de
of
saúde como
the
todo.
rendering of health
E a
services
área de
as a whole.
diagnóstico, a área de
The
laboratório, tem que
diagnostic
olhar
area, the
de
laboratory
várias
area,
formas. O
has
que
to
é
be
que
seen in
nós
various
estamos a
ways.
fazer
What are we doing
especificamente para
specifically
garantir que
in order to ensure
haja prestação de serviços? Número
a
nós
good
temos
provision of service?
documento
Firstly, we
estratégico
have
chamado
a strategic
Pacote
document
Essencial de
which is
Cuidados de
called
Saúde. Nesse
the
documento
essential
tem
package, the
conjunto
health
de
package,
intervenções de saúde que
in
devem
which you
acontecer ao
contain
nível
the
dos
various
cuidados primários,
health
né?
intervention at
E
the level of primary
segundo
care.
aquilo
And
que
secondly,
temos como
what we
documentos
also have
ratificados que a maior
as
parte
a
dos países
ratified
africanos têm, é que os
documents
cuidados primários
that is
são
being ratified by the
os
most African
principais para
countries, that
garantir
primary
a assistência adequada.
care
Então,
is
o
the most
nosso
important
investimento
to
também da
ensure
área
this.
diagnóstica
So
está
our
voltada
investment
muito
in
para os
the
cuidados de
diagnostic
saúde
areas,
primários, porque o
it
investimento
is turned very
de,
much
de
towards the
$1
primary
tem um
care,
impacto maior
which was
nesse
about
sentido. E a
$1
seguir,
that has an impact.
outro aspecto que fizemos foi rever
Another one is
o menu de
was to
testes
review
em todos os níveis e ver
at
até
all
que ponto nós
levels to
podemos
see at what
reduzir
point we could
custos sem
reduce
ter
the
impacto
costs
na,
without
na
an
qualidade de
impact
prestação de serviços.
over
Este é um
the
ponto
quality of the services.
muito importante.
And
Para
this
isso, nós
was a very important
desenhamos
feature.
cenários
For
onde
that
nós
effect, we
dizemos,
drew up
por exemplo, vou
scenarios
dar
where we say
algum
that I'm
ponto
going to
prático em termos
give
de
a
atividades que
practical
nós fizemos.
aspect in
Por
terms of the
exemplo, agora
activities.
temos
For
desafios como
example, we
emergentes.
have now
Nós dizemos quando
challenges
temos o cenário
that
de restrição crítica
when
do
we
orçamento,
have
quais são os serviços que oferecem uma
budgetary
unidade sanitária
constraints, what are the
no
services that
serviço de emergências,
that
na
would be
unidade de
required,
cuidados
particularly
intensivos,
in a
nos
certain
blocos
health unit
operatórios,
in
entre
terms
outros serviços,
of the
quais são
operating
os
units,
serviços que não
theaters,
podem
what are the
parar em caso de
services
dificuldade
that
de
we may not be
financiamento.
able to
Com
render
referenciamento da
in
amostra,
case of lack of
também
funding.
o mesmo
This
cenário. Como é
also
que eu
shows the same
reestruturo a
scenario.
logística
How
de
we to
referenciamento da
restructure
amostra
the
para
logistics
continuar a
in
cobrir
order to
os problemas de
continue to
saúde
cover
pública,
the
não
public health
impactando de uma forma significativa, mas continuando
challenges
a
without an
oferecer
impact, but
estes
also but to
serviços.
continue to
E
offer
quanto
these
é que custa?
services, and
Conseguimos,
how
com
much
a
it
equipa
costs. We
do
could,
departamento,
with the
fazer
team
essa
of this
precificação. Uma
department, to
atividade que
do
anteriormente
that
nós dependíamos
calculation,
muito
something
dos
that
parceiros para.
we in the past was heavily
De uma forma
dependent on the
geral, quando
partners.
temos a
General way,
diversidade
when we have the problem
de financiamento, ou quer
of
seja também de
funding,
uma situação de
particularly
catástrofe ou de
in the
problema de saúde pública,
situation of a
nós
calamity
já
of
temos de ver
public health,
internamente nos
we have
nossos
to
planos de
have
gestão medidas de
uh,
mitigação
we have
principalmente medidas de
to
comunicação importantes
domesticate the
para que as equipas,
emergency
ao nível central,
procedures
ao
and
nível das
plans
províncias, ao
so
nível
that
dos
the
distritos, ao
central
nível dos
level, or
municípios,
provincial or
possam
district or
continuar a
municipalities,
prover
they can
serviços, nem que
continue
sejam
to
serviços mínimos
provide the
que
services,
permitam que os
even if it is
programas
only at the
de
minimal
saúde
level in
continuem
terms
a
of
funcionar. Esta é a
health,
principal
to
mensagem.
ensure the
Termos
continuity of health services.
planos ou
So we
medidas
must have plans or
alternativas,
measures,
quer seja
alternative
a
measures,
comunicação convencional ou
that
voltar para medidas
or
com
to
caso em papel
return
e
to
consigamos
the
manter os
other
serviços. Esta é que é a
forms, such
mensagem
as
que nós
in the form of
temos e a Dionilde teve de
plans
se
drawn up in
ausentar.
paper.
Acho que a minha mensagem também fica a mensagem
And I
dela.
think
Obrigado.
that this is
Não
what
sei
I
se tem mais
wanted to
questões.
say. I don't know if you have any other questions.
Thank you very much. And time is not on our
Muito
side.
obrigado. Infelizmente o tempo não nos
Dr.
permite.
Pinto and team.
Dr. Pinto,
And
isso.
I will take that submission as the
Nós
wrap-up from
teremos,
your
portanto,
side, but allow us to
como
appreciate your
importante a
team,
vossa
the Mozambique team, for really
intervenção. Quero
making
agradecer à
this
equipa de Moçambique
very
por
great session. It is a lot of work that
ter
went into this, but also to congratulate you to the far you have reached, because it's not easy to begin working through some of this within 9-10 months, and then you're beginning to see things really unfolding in the direction that you desire. We will continue learning from you and other countries on how they're doing it, because it is the little details that we're seeing here that will actually create the huge impacts that we're looking for. And so we encourage you, as you continue learning, if there is anything significant, we will reach again out to you so that you can share with us. Antonio from Angola, you have an open invite to join the LabCoP. LabCoP is the Laboratory System Strengthening Community of Practice, from our portfolio lead, Dr. Collins Otieno. That's in the chat. And kindly reach out to Dr. Collins or myself, and we can push that discussion forward. Colleagues, time waits for no man, and so we have come to the end of this session. We'll make the slides available to our WhatsApp platforms and other social media platforms, and then once the recordings are available, we'll also make them available to you. And from us, ASLM, do have the best of your day, evening, or afternoon, depending on where you're joining us from. And be on the lookout for 1 or 2 more sessions before we close the year, and the flyers will be coming out soon. So have the best of your day, and bye-bye for now.